Good afternoon to all. The topic, the paper I'm going to discuss today is a case-matched analysis of laparoscopic total gastrectomy with or without jejunal pouch. Jejunal pouch following total gastrectomy aims at a satisfactory reservoir function which improves the postoperative quality of life, and also it improves some of the adverse outcomes such as postoperative dumping, impaired food intake as well as bile reflux. In the long run, though, there is no difference between the two groups with regards to the survival rates. The present study is a cohort-based study based on the prospectively collected data between 2011 to 2014. It's a 4 years period. During this period, 21 patients underwent pouch reconstruction, of which 4 were lost to follow-up. So the remaining 17 patients which were included in this study were compared with the same 17 patients without pouch reconstruction. Technically, it's a side-to-side anastomosis with the anterior closure is by the intracorporeal suture using a continuous running suture. We compared all the variables including the clinicopathological variables, post-operative as well as operative variables, on the follow-up variables which included follow-up at 3, 6 and 12 months. We also compared quality of life indices including the C30 questionnaire and the gastric cancer specific STO22 questionnaire and the gastrointestinal symptom rating score questionnaire as well. The UOTIC C30 version 3.0 included global health status, functional scales as well as symptom scales, whereas gastric cancer specific module STO22 included functional scales as well as symptom scales. The statistical assessment was done using the mathematical calculations as it was shown, which included item range, raw score as well as for functional scales the mathematical calculation, and for the symptom scales and the global health scales different mathematical calculations were used. Finally, this is the GSRS questionnaire which were also included for QOL assessment. So each symptom is scored from 0 to 4 and the total score includes the sum of all the 5 domains which was mentioned in this particular questionnaire. Coming to the results, starting from the clinicopathological features, no difference between the two groups with regards to the age, sex and the pathological features which included perineural invasion, lymphovascular invasion as well as the tumor grade. With regards to the operative and intraoperative variables, the operative time was more in group A, which is a pouch, it's about 70 minutes, whereas the blood loss, the time for return of bowel function as well as the hospital stay were not statistically significant between the two groups. The follow-up variables which included the weight gain or weight loss, total proteins, albumin, hemoglobin and serum calcium. Among this, the percentage change, the change from preoperative status showed difference between the two groups, with the pouch retaining the weight more when compared to without pouch. With regards to the quality of life indices, there were significant differences between the two groups with regards to the symptom scale, global health status, physical as well as role functioning, whereas the other indices including the emotional functioning, cognitive functioning, social functioning and fatigue were not different between the two groups. So did all the symptoms, which showed no difference between the two groups. With regards to the gastric cancer specific questionnaire, eating restriction was found to be more with that of group which is a straight anastomosis without pouch, but for other variables, no difference between the two groups. So to come to the end of this presentation, the salient feature of this study include the operative time, which was higher in pouch group by an average of 70 minutes. With regards to the quality of life scores, the symptoms related to oral intake using a functional reservoir were significantly superior in pouch group. And there was a trend towards better weight maintenance in the short term in the pouch group, with better physical functioning, role functioning, and better overall global health status in the pouch group. This study has limitations in the form of small sample size. It's a non-randomized study which basically aimed at a short-term outcome, leaving the long-term outcome, leaving out the long-term outcomes. And also, the technique is not so well standardized in a completely laparoscopic pouch. Generally, the studies address about the laparoscopic assisted, but our study was totally laparoscopy. So we need to concentrate on the standardization of the technique as well. So to conclude, I would say that totally laparoscopic gastrectomy with a Roux-en-Y jejunal pouch reconstruction is technically feasible and safe procedure, though it adds up to the operative time. Pouch reconstruction has a better short-term outcomes when compared to the conventional straight reconstruction. And in order to optimize the rehabilitation of the patient after total gastrectomy, a pouch reconstruction in this study can be considered, particularly in young individuals, early cancers, and in those patients expect to have a significant long-term survival. Thank you very much.
Questions from the floor? So in your practice then, do you think that given the limitations of your study, does this prove to you and this will change your practice? Or do you think that there needs to be a prospective randomized trial comparing the two operations?
Yeah, we need to take this particular issue forward and then do a randomized control trial, because it, especially the pouch reservoir function, has to do with the eating patterns. Eating pattern is different across the globe. In India, we are predominantly rice eaters, so the bulk we consume generally a bulk. It's not. It's more of carbohydrate, less of protein and fat. So we eat a bulk amount of quantity, and we are of the opinion that at least in India, a reservoir is necessary. But of course, a randomized control trial across the continent, in the sense multi-center and multi-continental study, will answer a further larger question of whether a pouch is required or not.
Great, thank you. Any other questions from the floor? Great, thank you very much.
Yeah, thank you.